Good evening. For my topic to debate, I chose opioids, and I will be debating why we should have supervised consumption sites in the United States, which are sites to legally and safely use drugs. So what are supervised consumption sites? They're a safe and hygienic place that allows individuals to use drugs under medical supervision. These sites are designed to reduce the overall risks associated with drug use, such as overdose and spread of disease. So, why should they be a thing in the United States? Number one, for the reduction of overdose deaths. A supervised site provides immediate medical intervention in the event of an overdose. Basically, at these sites, there's always medical staff ready to take direct action and are constantly observant of the patient, not patients, but the drug users at the site. We see this in countries like Canada. One study published by The Lancet in 2024 showed a 67% decrease in overdose mortality rates in neighborhoods that implemented supervised consumption sites. Also, disease prevention. Bloodborne infections are common amongst drug users. This is because a lot of drug users have the habit of sharing needles with each other. And bloodborne infections are defined as diseases caused by a virus or bacteria that are carried in the blood or other bodily fluids, such as hepatitis B and C and HIV. So basically any infectious diseases that can be transmitted through the blood. At these control sites, basically, clean syringes and safe injection equipment are provided for the drug users. This is to prevent anyone from sharing needles or any other equipment. And once no one's sharing the needles, the likelihood of transmitting infectious diseases decreases to almost zero. Another advantage of these supervised consumption sites are the costs savings to the healthcare system. So basically, once you do decrease overdose numbers and disease transmissions, emergency medical costs are lowered. Less people are in need of ambulances and stuff like that, and long-term healthcare expenses drop. Less people are needing these long-term healthcare plans for diseases such as HIV. One study published by the National Safer Supply Committee of Practice found that the SCSs, or the supervised consumption sites in Vancouver, saves millions in healthcare costs annually. And also overall reduction of public drug use. Basically, this one's obvious, like if you reduce the public drug use in a neighborhood, the community becomes safer. It improves the overall aesthetic of the neighborhood. The biggest concern is safety, really. A lot of homelessness is correlated with drug use, so basically the safer the drug use is, maybe lean towards lower homeless rates in certain areas. So basically, I understand that the promotion of supervised consumption sites can seem as if you're promoting the use of drugs or the potential for the increase of drug use because of the safety of it. However, the pros definitely outweigh the cons. It may seem as a extreme problem-solving set for a problem. However, this is just a reactive approach to a problem that already exists and is growing. The CDC reported that the rate of drug overdose deaths increased from 8.2 deaths per 100,000 in 2002 to 32.6 in 2022. So basically, this problem is existent, it's there, and not the only thing that we can do, but having supervised consumption sites is a reactive way for communities to battle this problem. So, yeah, that is my argument.